We can now treat Alzheimer's risk just as easily as cholesterol and diabetes risk. Most healthcare providers know the drill. You got high cholesterol, let's recommend changing the diet. Let's change the lifestyle a little bit. Maybe a statin. Your A1C going up? Well, let's tweak the nutrition, let's throw in some exercise, and maybe prescribe a GLP-1. What if I told you that we can now manage Alzheimer's risk in pretty much the same way? We can measure risk by looking at BAT levels, the #1 risk factor for Alzheimer's. And guess what? We can actually treat BAT levels with a safe FDA-approved medication. Wait, what? There's a pill for that? The answer is yes. And before you think that this is some big pharma push, think again. The medication I'm referring to has been approved by FDA for decades, and it's available in generic form worldwide, and it's being applied off-label right now for BAT level reduction, just like GLP-1s have been adopted for metabolic risk and now for weight management. But most importantly, patients only need one short cycle. This isn't a medication that patients have to take forever. Think of it like an 8-week steroid pack. It's a short, simple method to reduce long-term risk because here's the thing. BAT levels don't build up overnight. They accumulate slowly over decades. And for most patients in their 30s, 40s, and 50s, they've only just started to rise. And that's why a single short treatment cycle is often enough to bring those levels down, to reset the system and stop the buildup before it turns into damage. And after that, we just monitor those BAT levels just like we do with LDL or A1C routinely, annually, and with clinical oversight. And if BAT levels stay low, you're good to go. And if they start rising again down the road, we repeat the cycle, keeping treatments light and only as needed. This is targeted, temporary, and preventative medicine. And as of today, over 1,000 patients have participated in our protocol and counting. And early data is showing highly promising results. Patients are experiencing measurable reductions in BAT levels after just one treatment cycle, upwards of 87%. And while we continue our longitudinal monitoring to refine and expand our insights, the early results confirm the potential that this approach may have to make an actual meaningful impact on Alzheimer's prevention. Patients are clearing decades of biomarker buildup within weeks. The evidence from our ongoing rolling study reinforces what decades of peer-reviewed research have already told us, that lowering BAT levels changes everything. This isn't speculation. This is real-world data. We're not guessing anymore. We're not hoping for breakthroughs. We're already using them. And the sooner we treat BAT levels like cholesterol or A1C, the sooner we change the future of Alzheimer's, before it ever begins. Knowledge is power. Keep watching more.